Good afternoon, everyone. We are officially afternoon, and the trickle of attendees has subsided, and so we're going to get started. This is a very exciting lunch and learn today. We are talking about the role that people in recovery play in combating the opioid epidemic. Um, just briefly to tell you a little bit about Live Tampa Bay's Link Lunch and Learn webinar. My name is Jennifer Webb. I'm the Executive Director for Live Tampa Bay. If you are joining us for the first time, let me briefly tell you about us. Live Tampa Bay is formerly Project Opioid Tampa Bay, part of a statewide initiative funded by the Florida Blue Foundation and brought to the Tampa Bay region by the Tampa Bay Partnership. The goal is to mobilize business, faith, and philanthropic leaders in our region to join with traditional stakeholders to reduce overdose deaths in our community. We seek to accomplish this through a collection of interlocking efforts, including advocacy, education, and collaboration between the business community, frontline professionals, many of whom are here today, and members of our community committed to saving lives from opioid epidemic. We are all aware by now the CDC numbers late last year that showed over 100,000 overdose deaths within a single year. And y'all, the vast majority of these, over 75,000, were due to opioids. We want to use this webinar this afternoon to highlight the importance of community in combating this crisis and the importance of people in recovery leading this movement. Our format is going to look a little different as a result. Instead of specifically calling attention to one person's recovery story, we want to acknowledge that most people in the recovery movement to promote RCOs have stories of their own and that underpin their active engagement in the creation of recovery community organizations. We are excited to bring together some incredible people who are building and sustaining communities that support recovery and inspire us to strengthen that network. We are so grateful that you are joining us today to learn more about what recovery community organizations are, how they are transforming the way we fight the overdose and opioid crises, and we can maintain and strengthen them, and how we can maintain and strengthen them in the Tampa Bay region. We have a great group of panelists who will discuss recovery community organizations in just a moment. We also have the pleasure of having a familiar voice from the radio as a guide for this panel discussion. I would like to introduce Lisa Peaks as our moderator this afternoon. Lisa is in long-term recovery from drugs and alcohol addiction with 28 years since her last use. She was the executive director of Friends of Recovery in New Hampshire, now New Hope for New Hampshire, the statewide recovery community organization in New Hampshire. She holds a recovery coach certification from the Connecticut Community on Addiction Recovery and is a trainer of trainers for this model. She was also a member of New Hampshire's Governor's Commission on Alcohol and Drug Abuse. Lisa's primary career focus has been as a radio broadcaster and journalist. She spent decades working in New England and Tampa Bay area. Listeners may recognize her as the host of All Things Considered on WUSF Public Media, where she is now the midday host. Lisa?
Thank you so much, Jennifer. It's awesome to be here. And I just want to take a second to congratulate Live Tampa Bay for achieving that 501c3 nonprofit status. That's going to open a lot of doors, and it's very exciting. So we're going to introduce our panelists and hear about their work with the recovery community organizations. And first up is Philip Rutherford, who is the Chief Operating Officer at Faces and Voices of Recovery, which is a national advocacy organization. Phil is a recovery coach, and he is a passionate member of the recovery community. He also possesses a self-described doctorate from the School of Hard Knocks. Now, I've heard that's a very rigorous program, Phil. Congratulations on that. Now, as COO, he's responsible for multiple lines of business within the Faces and Voices ecosystem. He had a significant role in the conception, design, launch, and facilitation of the Recovery Data Platform, which is a cloud-based program, and it's the first of its kind, and it's quickly become a valuable asset in longitudinal data collection or tracking changes and trends over time for peer-based services. So welcome, Philip. And our next panelist is William Atkinson. He is in long-term recovery too since February of 2006. He started working in the substance abuse field in 2008 and opened recovery residences in 2011. And in 2016, he founded an RCO Without Borders, which operates in Pinellas and Pasco counties. Will's also a member of the board of directors since 2018 for Live Tampa Bay and forward to the future of statewide RCOs. And finally, I would like to introduce Robert Cooper. Robert is a military veteran. He has honorably served 10 years in the United States Marine Corps. From 2008 through 2015, Robert worked in various positions, including management in the food service and restaurant business. And in 2016, Robert went through a very difficult time personally. He realized that he not only needed, but also wanted to change his life for the better. And knowing that he could not achieve recovery on his own, he got some help from his family. He knew he had to rebuild his relationship with God first. And as he worked through this process, he realized that there are others who, just like him, needed help, guidance without judgment. So from this, 0 Hour Life Center was born. Robert is also a CCAR authorized recovery coach. We just welcome all our panelists. It's great to have you all here.
It's great to be here.
Awesome. So we're going to start with a basic understanding of what RCOs or recovery community organizations are and take a look at their value in the community. We'll spend just a few minutes here. And Phil, you're the national faces and voices of recovery person. So maybe you can spend a few minutes telling us what recovery community organizations are, and also what distinguishes them from other services or groups that try to address the problem of addiction.
Well, thanks, Lisa, and I'd like to thank you guys for inviting us to come. I'll start with this. Recovery community organizations are driven by the community. So while we are a national advocacy organization and we have a collection of best practices that we've been looking at for about 20 years now, I want to start with the concept that recovery community organizations are driven by the community. Now, we are looking for recovery community organizations, or what are titled as RCOs. We look for three things: the presence of three activities inside of an organization. One of those activities is direct peer-to-peer recovery support services. Now, across the country, I think there are approximately 50 different titles for what peer recovery support services delivery people are, but everything from recovery coach to peer recovery support specialist to specialist. But in general, this is a person with lived experience sharing their lived experience with someone that is seeking recovery. So we look for the presence of that. We also look for community education. So these are organizations that are providing education to the community about substance use disorder and about recovery support services. And thirdly, policy advocacy. So some activity, and we sometimes call it acted up, but some activity focused on changing policy as it pertains to people in recovery. So, and that's, by the way, we didn't make that up. Phil Valentine, William White, and a lady named Patricia Taylor documented this and kind of described these organizations to have these three characteristics, I want to say back in the early 2000s. So that's kind of where we're drawing that from. In that process, RCOs do a lot of other stuff too, but the kind of what we look at sort of structurally from a national perspective is, what is an RCO? It's people that are doing one or more of those three things.
Right. So we've got, the people with the lived experience, not necessarily professionals, could be, maybe not, education, and then the advocacy piece, one or more. So how does that distinguish maybe from a treatment organization that might also be doing one of those things?
Well, so first and foremost, we believe that peer recovery support can be a professional service, but it is not a clinical service. So one of the chief distinctions between those two things is that a treatment center, you might go to a treatment center and be provided with a counselor, and that counselor would look at your history and maybe do some questioning with you, maybe look at an ASAM instrument that describes where you are dimensionally, and then they'll offer a treatment plan. And that would be a full involvement. At an RCO, the involvement between the peer professional and the individual would look different in that there is a power dynamic that occurs in a treatment center that does not theoretically occur in the RCO. Now, obviously, we're all human beings. Someone's looking for help and you have the help. There is a slight power differential there. But the distinction between clinical service and peer service is really about that lived experience. So the person in an RCO, or a person that's delivering peer support services, would say, "Hey, I've been there. This is my experience, and here are some of the resources that I can help you find or help bring to bear in order to help you in your recovery." Whereas a clinician might offer something different. So it is not the cleanest distinction between those two, but the power differential is one big component, and the willingness to share lived experience is I think the other.
Gotcha. Now, Robert Cooper, oops, I'm feeding back a little. Robert Cooper and William Atkinson, you've each worked to establish recovery organizations. I'd like each of you to spend just a few minutes talking about the community needs that inspired you and your organizations. And William, let's start with you. What needs are you trying to meet and address in Pinellas and Pasco counties?
So specifically, what we're trying to meet is access to care. Oftentimes in our area, you either need to have a felony or, insurance to receive any type of assistance, or you end up in the first responder scenario where you've had a major medical emergency and then ended up in a hospital, something like that. We're directly meeting with individuals who otherwise wouldn't be served unless they had one of these emergency situations. And so what we're seeing is through Narcan distribution. During the pandemic, we had like drive-throughs where people could come get Narcan through educational summits beforehand. We are directly trying to reduce the number of overdose deaths due to the drugs that are available today. As well as providing individuals who are seeking help with the resources to be able to get that help. So as a person in long-term recovery myself, I might be able to help someone I'm going to approach this differently. I started out my career in treatment, and the thing that we were taught was you don't go to a back surgeon expecting the back surgeon to have had back surgery. The idea is that if a client does what they're asked to do in treatment, they're going to be okay. The problem is that relationship always ended. So the minute that somebody left the controlled setting, it was kind of, well, now HIPAA laws apply. We can't talk to them again. They're gone, and we never know what happens. In a peer supportive role, there's no end date, and there's no amount of okay, we can't talk to you anymore type of process. So we get to work with where they're at, regardless of their use. So if they're currently using, we want to work with them. If they're trying to maintain abstinence, we want to help them. We want to help them if they're currently using, not to pass away or negatively impact others. The whole idea is that we're going to be able to do these things that the emergency room can't, treatment centers can't, detoxes can't, only because they're there for a finite amount of time. Whereas peers, recovery coaches, all of us are CCAR recovery coach trained, have the opportunity to essentially jump into the pit with them. So that's what we're addressing, is the lost souls who otherwise don't get seen.
You mentioned Narcan. I just want to say that's an emergency overdose injectable treatment that a lot of first responders use, that and families can have access to that. So you're talking, Willie, mostly about access. That's the primary issue you're seeing in your community. Robert, Zero Hour Life Center has a few locations in Florida. What are some of the community needs that you're trying to address?
First of all, I want to say thank you for having me on this panel with two awesome allies in recovery, Mr. Will and Mr. Phil. But yeah, we are at Zero Life Center. We cover 5 counties, and all my counties are different, and so but they all have the same problems. And what we're trying to do, and what we do, is we help bridge the gap. So we want to connect people to the resources so they can be able to sustain long-term recovery. And we are really trying to build recovery capital in their life. A lot of our communities have transportation barriers. So any barrier that we see that is going to affect someone to sustain recovery, we're trying to connect them. Our community, we do a lot of advocacy within our counties. Big ticket items. We're trying to implement a recovery pods in our jail, because we're trying to meet people where they are, because we have a lot of people that in substance use that keep going to jail, and it's a wheel. So why we should be trying to meet them right there and start them onto a road to recovery, while they're waiting on a court date, while they're waiting to be seen or whatever, and upon release they already get started in their recovery, and then they come to the recovery community organization. But a lot of our counties, like I said, have the same problem. Is a lot of people can't get to treatment. So they'll send them to us, to the recovery community organization, and we will start working with them in some form or fashion to introduce them to recovery. So that's what we're doing, and we're doing some. And two is one thing that we do is we try to pull the community together. A lot of people are doing great work in one of my counties. One of the counties have a lot of recovery, but it feels like sometimes there's a silo, and the individual that's trying to start recovery don't know where to start. So what we do is we try to pull all those stakeholders together, so we can all sit at the table and have good conversation of how we can help this community, or help our people that's in substance use.
Yeah, so connecting people with resources, bridging the gap, and both you and William mentioned the words long-term recovery and the continuum, and that's so key. Philip, what is the role for an RCO in the overdose crisis and in fighting the crisis? What issues or problems are RCOs uniquely positioned to address?
The first thing that comes to mind for me is boots on the ground and relationships. I think that, and I want to be clear, my comments earlier regarding treatment, and this pertains to prevention and any other, like we want support for people with substance use disorder. I'm also a person in recovery. We want support from everyone, but specifically around RCOs, this is there's not a criteria really that you have to meet to walk in the door of an RCO. You can walk in the door and say, hey, I need help, and my experience around the country is someone's gonna help. And it's not that those other organizations don't want to, but there's a measure of organization and bureaucracy associated with getting set up for services there. A lot of RCOs, you just walk in and say, hey, I need some naloxone right now, or I need somebody to come talk to me right now. And the nature of substance use disorder is that is when we believe that is when help is most beneficial, is on the spot and right away. Also, what's going on around the country is in emergency rooms, in treatment and recovery courts, in social services offices. we're seeing peer support people deployed in a way that they can, again, give that immediate assistance to people that need help in pursuing recovery. And that is unique to this structure. And it's one of the reasons that we are so aggressive in the way that we advocate for these services, because I think this is the front lines. We believe this is the front lines.
Yeah, it just goes back to what you were saying about the emphasis on community, people having all those unique connections and knowing, who can do what. So Robert and William, maybe a couple of minutes each on this. Why is it important for people in recovery to be the ones who lead?
Robert, do you want to take it or can I?
Let me go. Thank
You
you,
got
Mr.
it.
Wood.
You got it.
Because it's, the main thing about a recovery community organization is peer led. And, everybody that's involved in the recovery community organization has been touched by substance use, or their family member in substance use. You come in our recovery center, our recovery specialist right there at the front door. Someone walks in, she's a person in long-term recovery. And, we have a lot of peers that's getting involved now, and they're, doing some outreach, planning different events within in a different community. And the reason why is now they have a purpose. Now they feel attached to something. And while we're in our addiction and substance use, we are always isolating ourselves. And sometimes when people get into recovery, we always want them to do this, but they don't feel a part of something. And so when they start getting involved with the recovery organization, everyone can, I tell them, everyone has a voice. Everyone can feel needed. You can do something. You have gifts and talents, and it can be used in the recovery organization. I always tell them this. I say, this is your RCO. I'm just a vessel. This is yours. So however you want to get involved, and no idea is dumb to me. And we have some great people. We have some great peers standing up and really getting involved in their community and want to see change, want to see help for people that's still in substance use. So it's so important for them to get involved, and we should make it welcome for them to be involved. They should come in there and they should feel like it should feel like a center where they can come in and be a part of something, not feeling like it's clinical, it's treatment where they're walking into a doctor's office. It should feel like a home away from home. Go ahead, Mr. Will.
Yeah, that ownership piece. William, why should folks in recovery be the ones to lead these RCOs?
I honestly don't know if I can say it better, Mr. Cooper. That was really well done, sir. The who else is going to do it is my thought process. All right. Once again, it's those of us in recovery who have been lucky enough to maintain whatever recovery looks like to you. All right. And that is an important distinction. All right. When people say they're in recovery, but that comes with an activity behind it. So a pathway, something that's meaningful to them that they then turn around and help others with. And some of us, and I like to joke around with other people in recovery. I hope this joke will land, but essentially some of us become cliches like myself and join a profession, where, hey, this is something that impacted me personally, and I find it absolutely necessary to do what I can to make the road to get here easier for somebody else. And it's so awesome to be in recovery. Like, part of what we're doing and what Philip has done at Faces and Voice of Recovery with the RDP, it is demonstrating what Dr. David Best's Recovery Capital study suggested, which is those of us who find recovery are actively more involved in our communities in helping others than if we had never had a substance use disorder to begin with. So what they've created is this ability to track what recovery capital is, and which those of us in recovery have known for a long time, that we are uniquely capable of benefiting the world around us the same way we were uniquely capable of hurting the people and community around us when we were using. So it's this beautiful shift, and the RCOs are a vessel, an avenue for anyone who is in recovery to get involved and to be a part of. And so that's why it's such a privilege to be here with both of these fine gentlemen who are doing such amazing things in the community and nationally, because it takes all of us, regardless of where we are in our recovery journey, regardless of where we are in our profession, to stand together and say, hey, what we've been doing as a nation and as a society hasn't worked. So here's a potential option that is demonstrating results, and we hope that you will be able to see them the same way we are.
Beautiful, gentlemen. Thank you so much. And that's a great piece when you look at the data. You can point to something. Here's what has worked, and we can show you now. We've got this legacy of it being tracked, and that's a beautiful thing with that RDP. So we're going to wrap up with one final question, probably for Phil, I think. There's a lot of money coming in for clinical treatment, and that can be really tempting for an RCO to try to change their programming in order to claim some of that money. How can we preserve the integrity of the community aspect of RCO so that they don't, morph into treatment centers?
Well, and I don't know if this question was actually tailored for me. Some of my history is that I ran an RCO in Minnesota for a period of time, and this was back in the bad old days when, well, not that people suddenly care a lot more, but this is back when there really was no money. It was largely a volunteer effort, and no money coming in externally. We had to sort of figure out how to fund the recovery activities. So we developed the idea that, okay, we'll start treatment here. And without the benefit of hindsight, it started well, and there's nothing wrong with treatment. But what we discovered after a period of time is that the clinical nature of the work that was being done there really started to interfere with people showing up. And I know this for a fact, because people prior to this, people were showing up all the time. The center was humming, and I'm sure Will and Robert know what I mean. Like, there's people coming and going. You got dominoes, you got cards, you got somebody yelling about something, and you want them to quiet down so you can actually get some work done. So that was the environment. And 9 months later, it was a ghost town in there. So we did I'm a data guy, right? So we did some polling, and one of the most common pieces of feedback is, I don't want to hang out at a treatment center. And again, I'm not saying anything bad about that, but there was something about that kind of community location thing that went away when, as an organization, we were forced to, we had to enforce HIPAA, and there were some rules about, and Minnesota is particularly picky about how stuff is and what doors are locked, what doors are unlocked, where people can go, and all of that. And that had a negative effect on the treatment center. In hindsight, we probably were on the right track in that we could have opened a treatment center in a different location, but trying to mix those two services in one location in that particular experience was bad. That's my personal experience. Nationally, what I have seen is that organizations that attempt to do this tend to lean one way or another. I don't know of many that keep both services in perpetuity going at the same time. Usually there's a shift one way or another, either shift back to RCO or shift fully more into treatment. And there's revenue to be had there, and it's important. Sustainability is something that we train on. I know it's important to keep the lights on and keep people with a paycheck in their hand. I think the opportunity right now, though, is that as more money moves specifically into the recovery space, there is an opportunity for people to demonstrate proficiency with peer recovery support services and hopefully get some revenue going that way.
Yeah, it's good to see that evolution, that which gets measured gets improved. So you need to have that measurement piece, and yet, let's keep it in community and keep the funding going there. So I need to shift back to Jennifer to take us into the next portion. Thank you so much for your wisdom, and I'm looking forward to picking this up in the second part.
Thank you.
All right. What an exciting first portion um, of this webinar. Thank you so much, Lisa. Thank you, panelists. Right now, what we want to do is just take a little bit of a break and shift our attention per your suggestion last month on how much y'all enjoyed highlighting different community partners. Today, we are highlighting Groups Recover Together. And so I want to take this moment to introduce Whitney Hewson, who is the Business Development Manager for Groups Recover Together. Whitney has been in the addiction treatment industry for 17 years and has a passion for helping others. She studied psychology at Azusa Pacific University and received her CAC in 2010. She has worked at all levels of care and with all populations, including mothers and children, pregnant women, drug court, work release, and now with those suffering from opioid use disorder. Whitney seeks to educate the community about addiction and to assist those struggling with the disease to get the help that they need. Whitney is a person in long-term recovery herself with 19 years of recovery and currently resides in Orlando, Florida. Whitney.
Hey there. Thank you for the kind introduction. Hopefully you guys can hear me okay. As you can see, I'm in my car. I had a little emergency and I said, well, this is how we do it, right? So I'm with Groups Recover Together. We are an outpatient opioid use disorder treatment center. And what we do is we provide therapy to those suffering with opioid use disorder. So at our center, we really try to strive to really make it a different model, right? Like we use evidence-based models and really all that good stuff, and we track everything, but the real goal here is to provide help to those experiencing opioid use disorder. And if I can just say, today's webinar has been on fire. Like I'm so pumped up right now. I'm super excited. So it's even hard to focus on what I'm supposed to tell you because I just love everything that everybody was sharing. So I'm super excited. I love RCOs, and we actually fit really well with RCOs because one of the things that we do is we meet our members where they're at. We make sure that we meet them where they're at. We're not asking them to come to us in the sense of we're not asking you to, be completely abstinent. We're not asking you to come to group, every single day or anything like that. Really, all we're asking is that they take their Suboxone for 7 days at a time, and that they go to group therapy once a week, and they engage with our care navigators. And we also have peer support specialists, as was mentioned earlier. And that's really how we are seeking to change the model of what happens with outpatient therapy for those with an OUD. A lot of times that prescription is given for a month, which, there's different models for different reasons. But what we found is our 7-day prescription really helps our members stay engaged in therapy with us, but also helps keep them accountable to their prescription. And so that's really important to us. And so that's how we, that's our basic model of that 7-day prescription, group therapy, and that care navigation is super important to our members because that's where we connect them with things like RCOs. That's where we connect them with, rental assistance. Maybe they are having a hard time getting rent, there's other things like education. Maybe they want to go back to school or learn a trade or do things of that nature. And that's really where we're there to come alongside our members again and really meet them where they're at. And that's really, really important to us. If you can go to the next slide. So that's our basic, model of how we do things at Groups Recover Together. And the way that we make that happen is really through what we're talking about a lot here. And that's partnering together with people. I think that, and it was already mentioned, that there are so many silos. Sorry, I'm getting a phone call. Wow, look at that. There are so many silos that we work in our communities, and we really aim to stamp out those silos as much as we can. We want to work with everybody. We want to make an impact in our communities. And we want to see that population level reduction of overdose and where we're at. And the only way we can all do that is if we work together. So we really seek to partner do presentations whenever we can. I get the honor to do a harm reduction presentation here soon to a bunch of OD2A people. For those of you who know what OD2A is, but I'm just honored to be a part of this company, to be able to help. To be able to help people with this it's an honor. It really is. And I'm super excited to be here on this, and to also have the honor of being spotlighted. I really appreciate this opportunity just to chat briefly about what we do. I put my name and my contact information in the chat as well. So if anybody would like to speak with me, that'd be great. And yes, I'm not driving. I think I saw somebody say something there. I pulled over for you all. So thank you guys again so much. And I look forward to the rest of the webinar.
Oh, perfect. Thank you so much, Whitney. Yes, and I really appreciate you pulling over and giving us a brief introduction to Groups Recover Together. Quickly before we move back to the panel, where is Groups Recover Together expanding into? Because I know that you're new into the Tampa Bay region, and I think that folks on the call would really be interested to know what counties y'all are expanding into.
Oh, wow. Great question. So we're actually 100% virtual right now, but we have 12 locations now. I want to say our Titusville location opened today. And so we're over in Lakeland, North Fort Myers, Port Charlotte, Port Richey, Largo, soon to be Clearwater. We also have Ocala, Inverness. I mean, we're all over. Orange Park, Orange City, we're everywhere. So we're happy to be here and happy to be a part of the solution in our communities.
Excellent. Thank you so much, Whitney. And safe travels on the rest of the journey. And thanks for joining us.
Thank you.
All right, y'all. So I want to turn back to our panel discussion to get just a little bit to explore recovery community organizations a little more. And to more specifically what RCOs look like locally and how we can strengthen this movement. Lisa, I'm going to turn it over to you.
Awesome. Thank you so much. Whitney, that was a great presentation. Kudos to you for making this space safely to share that with us. And that in seeing the linkages and the spokes and the interconnectedness, and also taking a look at the opportunities for intervention and referral to recovery supports. I did a very, very cursory look at the state block grant for substance abuse services, about $8 million, $9 million, and none of it is marked for prevention, for advocacy, for recovery. It's almost all for treatment. And I want to say I did recognize a portion of that money going to the Bradenton area and for what they call SBIRT, or screening and brief intervention and referral to treatment. That is a great front line for recovery support services to refer. I also want to recognize our Attorney General, Ashley Moody, for being part of this call, just putting a bug in your ear about the importance of getting some of that money out into other services. So continuing on, Phil, I want to ask you what role Faces and Voices of Recovery plays in supporting recovery community organizations.
Well, from a national perspective, and I'm sure plenty of people on this call know that this year, based on advocacy work, not just by us, but by us and some other organizations, for the first time ever, there is something called a recovery set aside, which is a portion of there's a thing called the block grant. It's a funding mechanism that SAMHSA uses to distribute money to the states for prevention and treatment. And that money is sort of targeted at prevention and treatment. This year, for the first time, and this is all about grassroots advocacy, we have a 10% set aside that is written into the budget that should for funding to go directly to support services, to recovery support services. So at a federal level, we advocate for funds to be targeted specifically at recovery so that when the money reaches the states, and obviously the Fed doesn't know, the states know better how to manage money than the Fed. And it's not a value judgment, it's just they're closer to the location. But what we've seen nationally is exactly what you described. A lot of money going to treatment, not very much or none going to recovery support services. So that's one of the first things that comes to mind when you ask that question. But beyond that, we also work in states to help train people to advocate for themselves and to like share some of the stuff that we've done nationally. We try and help train organizations to go to their policymakers and say, hey, recovery helps. By the way, here's some data that says recovery helps, and where's the money for it? So I think that is sort of the primary way that we're helping to try and move money to RCOs. And there may be others, but I don't want to take up time from William and Robert.
Yeah. Well, thank you so much. I guess with this next question, a couple of minutes for each of you, Robert and William, on what your organization is and how it serves the recovery community. William, could we start with you?
Sure. We're a recovery community organization. We've had a number of different ways in which we connect to the recovery community. But in short, I think it's been mentioned before, we are a free, open service to anyone at any time. Family member, friend, person in recovery, person struggling with a substance use disorder, someone who is in recovery and wants to help out. We are essentially a resource hub where we allow people to hang out. I loved what Phil was talking about because that describes our little small area on a regular basis. We got a couple of TVs set up and playing video games and just a safe space where people can hang out during the day, while a couple of offices where recovery coaches meet with their participants throughout the day. We establish events and organize other advocacy opportunities. Robert and I have recently been talking about such an event. We need to keep talking about that, my friend. Yeah. But that's what's kind of beautiful about all this is we meet up at an advocacy thing like in Tallahassee a couple of weeks ago, and then we go back into our local areas, and there's just so much work to be done that we roll up our sleeves, get to it, and days just kind of pass by. So to answer the question in a short, succinct way, I can't. Anything that people need and we are able to provide, we want to do that. And if we can't, we want to advocate for getting it so that we can do that for them. Because once again, it's just about, and Philip said this best, when someone says they need help, that's the time to get it for them. So if we can, that's what we try to do.
Yeah. How about Robert, sum up the entire history of your organization and what you do in 2 minutes?
We do a lot what we'll do, but one thing I like about the state of Florida and all the RCOs is that we communicate with each other, and we are all colleagues and friends. And there's not a day I can't pick the phone up and call another RCO in another county and say, hey, I need some help, and they'll be right on it. And that's the dynamic of the RCOs in Florida. But what Zero Life Center do is, we work a lot with our courts, getting those people, those participants back acclimated to their community and to help them sustain long-term recovery. We have people we get a lot of referrals from people within the community. We link them up with groups, all recovery groups, not designated one type of recovery. We do a program called SOAR Works that helps somebody apply for disability, which is free. We don't charge a fee for that. All our services are free. And we do a lot of recovery coaching, where, meeting them, walking along with them in their recovery and removing barriers. If it's, you need a suit for a job interview, we're going to get that suit. We're going to try to remove barriers for you to sustain recovery, because it may be minute to me, but that's a big barrier in your life. And, we look at the whole person, and we do a lot of different events in our community, and we're planning one now for one of our counties in May. where it's going to be, anti-stigma campaign where we're going to let our people get out there and, talk and show what, recovery is doing in their life. But, we do a lot, but we stay in our lane. And our main focus is to really, really get people connected to the recovery community. And I like how Mr. Phil said the key word is community. And the biggest thing is really getting the community to get involved in recovery. We've got the people involved, but sometimes the community is not involved. And without the community being involved, it's hard for someone to sustain recovery if the community is not welcoming. And some communities, a lot of education. I do a lot of education, going around and ask the question, hey, how do you feel about recovery? What's your view? Like Will said, you can come in there, you can watch a movie. I have a gentleman come in there, you watch kung fu movies. So it's open to the community and people that's in recovery.
Yeah, like what you were saying, or what Phil was saying about, the boots on the ground. We're going to hook you up with that suit, we're going to mobilize right away and get you what you need. And you're talking about how the RCOs in Florida talk to each other. There's clearly a lot of interest on our chat right here about, where is one located near me? People want to get involved. So my next question here is, what should people know and do to start an RCO in their community? And Robert, we'll just stay with you.
Well, what you can do is, I know that and I can speak for myself, when we got started, back then in the state of Florida, there was only like one RCO. And then, so the term recovery community organization was foreign in the state of Florida. So now there's a lot of traction and movement. I say that if someone want to start an RCO, Faces and Voices is a great platform to look at. Floridians for Recovery, which is the state RCO. Those folks over there, if you want to find an RCO, they got the RCO locator. They'll provide technical assistance to get you started. And they'll link you up with one of the RCOs in Florida so you can get some mentorship, and Face the Voice will give you a mentor. So right now is a great time where there's a lot of help if someone want to start an RCO in your community. But the thing I say about if someone want to do that, learn your community and see what your community wants. All right, learn your community and see what the community wants. Ask the community, hey, what if we did this? What would you want to see the RCO to do? And because that's the key word, is the community. It's community driven. So start with your community first and see what they would like.
Yeah, that's what you were saying from the very get-go, that you have unique needs in the communities that you serve. I'm hearing you also mention the judicial system a lot, and Will, you were talking about access. That was the key issue for your area. What would you recommend for people who want to start and get involved in an RCO?
Reach out to any one of us, reach out to Floridians for Recovery, reach out to Faces and Voices of Recovery. There cannot be enough RCOs. And I know that seems odd for us in the substance abuse world. If we've been in it a long time, we've all experienced some level of the competition. We all know that there is a lack of funding for this much needed life-saving process that we are all a part of. There's nothing to compete about. I just need that to be made so incredibly clear. We are talking about individuals coming in who have nothing, all right, who just need somebody to be there with them, all right? That doesn't require anything other than compassion. So I really want to, when you want to create an RCO, man, please, I'm so excited. I've seen a couple of these guys already pop in here. Justin and a couple others from the Hope Shot. They're an up-and-coming RCO up in the Pasco area. I'm telling you, man, we would love to not be so spread out. I would love to have, like an RCO in St. Pete, Largo, Clearwater, Tarpon, Newport Richey, Port Richey, Hudson. I'd want to see an RCO everywhere. I mean,
Amen.
so the thing is it's nothing about, it's not a, sorry, I didn't mean to cut you off. I get all fired up. It's it's an opportunity for all of us to come together at any time and say, hey, a group of us in recovery want to start an RCO. What can I do? And we'll help you. We'll walk you through the process. Anything you need.
Well, I think we are.
Wait,
Thank you first,
wait,
Phil. I know we're at time, but could you talk a little bit about registration for the RCO boot camp?
yes, and I'll be brief.
Oh, of course.
You're in, if you're on this call and you are in Florida, a big shout out to the state of Florida in that there is already mentorship and something called a virtual learning community that is available to you. It already exists. There's already an infrastructure that that we have built for people to just bring basic questions and get mentorship. RCO Boot Camp is a training that we give that is designed to sort of do the things that we're talking about. So to give people information about how to assemble stakeholders, maybe run a town hall, kind of like Robert was describing, to understand what the specific community needs are, and that can be done if you can take a look at our website. Also, I'm sure my email is somewhere in the chat. If it's not, I can make sure that we distribute that to the email list here. And we have a whole team of folks at Faces and Voices that are focused on Florida. So as soon as you said that, I was like, put me in, coach. Put me in, coach. We got some stuff that we know how to do. And we also partner with Floridians for Recovery, so we can work it out. If you're on this call and you want to start an RCO, please hit me up. That is all.
Thank you so much for all your great input. This is just wonderful. And thanks, Live Tampa Bay, for this wonderful webinar this afternoon. Jennifer.
Thank you, Lisa. Thank you, Robert, Philip, William. What an amazing panel discussion. The chat was going wild the entire time. People really do want to get engaged. And we did, we brought onto the panel those RCOs that have been longest standing so that we could really dive deep into, how you did it over the years. But there are other people in the audience that are, have set up RCOs. So if you're interested and that would love to expand their board. So David is on right now, and he is in Hillsborough County, David Broughton, and he is on the executive board of Hillsborough Recovery Collaborative. I've just put his email in the chat. So if you're interested in doing something in Hillsborough, that's a great opportunity to join in with an effort that's already underway. And of course, we will be having, we're directing people to the boot camp the 22nd, 23rd, and 24th that Faces and Voices are having. Our staff at Live Tampa Bay will be there as well. And after the training, we'll have folks who are like William will be there, Robert will be there, Ken Brown from DCF will be there, answering questions about what it's, the nuts and bolts of setting up RCOs in our specific region in Florida. So please, if you are interested in setting up an RCO, reach out to Phil, go to that boot camp, and we will also see how we can provide you further technical assistance. But now with the 3 minutes, I'm supposed to give a legislative update. Here's the deal. So we have a lot of good bills heading to the floor. The peer recovery bill is about to pass from the House floor as well. It's uncertain if they're going to accept the House's language or the Senate's language. That's the Rusan bill that's perennial and comes up every year. There is a overdose prevention bill that expands where you can give out Narcan, who's covered in deploying Narcan in our communities, and getting basically Narcan more into our communities. That has been sponsored by Representative Caruso in the House and by Senator Boyd and Rusan in the Senate. That is, the House version is heading to the floor. It's already passed off the Senate floor unanimously, and so that's moving along. The other bill that has expanded the definition of murder. It has some proximate cause language in it, and also if you're dealing drugs within 1,000 feet of a recovery home, or that bill has been changed in the Senate, and they actually added the fentanyl test strip language onto the Senate and took off the proximate cause language. But it's moving along. It's heading to its final committee in the Senate, and it is hanging out in the House. Those two bills look very different. So if you are interested in letting your voices be heard on those bills, now is the time to do so, because we only have a couple of weeks left of this session. So final minute, I want to turn it over to Father Victor. Father Victor is the pastor of St. Teresa of Calcutta Catholic Community, Castina Parish, to give the closing invocation. Father Victor has served in a variety of roles. He has served as supervisor, seat 3 for Sumter County, Florida, as a vicar for ecumenism and interreligious seminary professor in homiletics, and has been the hospice chaplain for local hospitals. Father Victor has served the Catholic Church for over 33 years, and he is here to close us out today. Thank you all for joining us, and this recording will be available to you in our follow-up email.
Thank you, Jennifer. I'd like to share with you a Native American prayer to the Great Spirit. It carries a message that as we work through each day on this path toward recovery, only one thing is truly known. There is much we do not know yet now. O Great Spirit, whose voice we hear in the winds, and whose breath gives life to all the world, hear us. We are small and we are weak, and we need your strength and wisdom. Let us walk in beauty and make our eyes ever behold the red and purple sunset, and make our hands respect the things you have made, and our ears sharp to hear your voice, and make us wise so that we may understand the things you have taught your people, and bless each and every one of our efforts in our struggles, in our walk, in our light for the people, for we are their neighbor. Amen.
Thank you so much, Father Victor. That was a beautiful prayer to take us out. And as always, we appreciate your feedback. So we have the link to the survey in the chat. If you want to see something different, something additional, please let us know. We'll also send that to you via email. And this has been a usual event for Link, Lunch, and Learn for Live Tampa Bay. And we look forward to seeing you next month, where we do an actual full legislative recap and anticipate special guests like we had today, Representative Leonard and other state representatives, state legislators who will pop by to join us and tell us about their victories this legislative session. All right. Thanks so much, everyone. Bye now.